And we're already getting a lot of those text messages in right here for Cone Health's Chief Pharmacy Officer, Dr. Deanne Brooks. First question we've had is a lot about when you can and you can't get the COVID vaccine based on other illnesses you've had. Someone wants to know, can you get it if you have laryngitis?
So we typically want people to feel good whenever they get any vaccine. And so I would recommend that you feel well before you get your vaccine.
What about if you've had liver disease in early stages? Can you get it then?
I would talk with my doctor and just ask for sure from my doctor who's treating me if they wanted to. Most likely it would be fine, but I think it would be a good idea just to ask the question.
Yeah, anytime you have a question about underlying conditions, you want to talk with the doctor first, right?
Right.
We also have a lot of questions coming in about the flu shot. Can you get the flu shot and the COVID vaccine at the same time?
You can. Early on, it was recommended not to get any other vaccines at the same time or even within weeks of getting the COVID-19 vaccine. And we know because we've given so many more doses of this vaccine now that you can even get them on the same day. It's just recommended that you would get them in a different arm.
And a different arm, why is that?
Well, you just want to make sure that you've got enough muscle mass that is absorbing the vaccine. And so best to get it from one in one arm and one the other.
You talked earlier about a different formula in the kids' vaccine. Do we know what might be changing?
We know it's a smaller dose, so in the 12-year-olds and above, the dose is a 30 microgram dose of the Pfizer vaccine, and for the under 12, it will be a 10 microgram dose.
But is it the same like bottle of stuff and you're just putting less in the needle?
No, it will not be. It will be a new formulation. So we'll get a new vial and it will have a different concentration that we'll be giving.
What kind of safety test has this stuff been through? A lot of parents are nervous about giving it to their kids.
Yeah, so it's the same safety test that we have for adults as well. And so the medication is given and the recipients are observed for any kind of problems that they would see. And that's what we'll find out whenever all of that safety data comes through. And we know from what we have seen that it is safe and effective. And the further proof will be the FDA and the CDC authorizing it for use.
If someone has had COVID as a breakthrough case, should they still get the booster?
They should still get the booster, but they could wait a little bit, make sure that they're not in quarantine, but they still could get the booster to ensure that they have the maximal immunity.
How long do you have to wait after having COVID before getting the vaccine or the booster?
Yeah, so we really like to make sure that someone is out of quarantine. And so we'll typically say wait about 30 days.
And why is the antibodies from COVID not enough? Why do you still need that vaccine?
It's just to continue to boost the immunity that you would have if you are eligible for that booster.
People want to know again, who exactly is eligible for a booster? So will you go over that one more time?
Sure. If you're over 65 years old, you're eligible. If you have a chronic medical condition and you're over 18, and a chronic medical condition would be diabetes, high blood pressure, any other medical condition that you're being treated for by your physician. If you're over 18 and you work in a high-risk setting, meaning that you are with a lot of people, so if you're a grocery store worker or a teacher or you work in healthcare, you would be eligible for the booster. And then the last one is if you're over 18 and you live in a setting where there are a lot of other people, so a group home or a college dormitory.
We'll tackle that right after this.